One of the worst exercises for cervical kyphosis is the chin tuck exercise. You know, doing this. Well, if your x-ray tells you you have a cervical kyphosis, that is by far the worst exercise to do. And in this video, I'm going to show you why by using a spine model, and watch right to the end because I'll point you to some exercises that are actually more appropriate for cervical kyphosis than a chin tuck. Keep watching. Hey there, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. What this channel is about is giving you tips and strategies on how to strengthen and stabilize your back. Like this, you can bend, move, and lift normally without pain and limitation. I also introduce my viewers to corrective chiropractic techniques. So if you want to see these techniques, you want to see them in action, you want to hear about them and learn these tips and strategies, do subscribe right now. Like this, you don't miss out on my weekly video updates. A cervical kyphosis is probably one of the more severe misalignment configurations of the cervical spine of the neck. And the reason is that it's actually a reversal of the normal alignment, which is not good from a structural perspective and from a biomechanical perspective, and also because it stresses the spinal cord and nerves dramatically. So let me show you what normal looks like first. This is a spine model. The cervical spine, so here's the front and here's the back. The cervical spine should basically approximate the shape of a circle. It has a geometric shape of a circle. So that's called a lordosis, okay? Lordosis means it's bending backwards, okay? This direction. Nice C-shaped curve. A kyphosis is an actual reversal of that, okay? And what happens with a kyphosis is the actual weight of the head and neck above this point is now on the anterior vertebral bodies. So the anterior parts of the spine here, the vertebral bodies and the discs, that cause a tremendous amount of stress, biomechanical and load stress that eventually deteriorates the spine into degenerative disc disease and degenerative arthritis disease, and also tensions and stretches the spinal cord. So that's the consequence of a cervical kyphosis. Just not a very good situation to have, and it's definitely not normal. So oftentimes people with neck complaints, so cervical kyphosis has an 18 times more likely presentation for neck pain and disability related to neck pain. And oftentimes someone with a kyphosis, they may not even know they have it because they haven't had an x-ray taken. So they're gonna get some kind of treatment or care in some kind of office, right? Some kind of treatment office. And one of the most common exercise people give for neck pain is a chin tuck. So this exercise here where they're pulling the head back, right? So that's a postural correcting exercise, but it's the most inappropriate and the most wrong exercise to be given for cervical kyphosis. And this is why. So a cervical kyphosis is a reversal, right? So like that. So a chin tuck is doing this, back like that. So the purpose of a chin tuck is to actually improve the forward head translation, which may have some curve in there already, maybe because of an upper thoracic kyphosis possibly. So you need to reduce the upper thoracic kyphosis, pull the head back, and bring that configuration, which is already curving or some curve, back ear to shoulder to train those muscles to maintain that posture. That's what a chin tuck is supposed to do. But if you're doing that with a kyphosis, you're literally bringing back a bad curve position. And many times in a cervical kyphosis, the ear is already lined up with the shoulder. So C2 is lined up with C7 already, or T1. So what you're doing is you're basically bringing back this kyphosis further into a more inappropriate misalignment. And that's not right. And that's why a chin tuck is not good for a cervical kyphosis. Now, instead, what's required is to create a fulcrum point at this reversal point and bend the neck. So my thumb is a fulcrum point. Bend the neck over that fulcrum point. And then you can pull the spine over that fulcrum point, creating the lordosis as you're doing that. That's a better, more appropriate corrective exercise for a cervical kyphosis. And if you want to see how this is performed and some other exercises for cervical kyphosis, you should watch this video right here, which is one of my most popular videos about cervical kyphosis exercises. Go check it out right now.